Good morning, everyone. Happy to see everyone, and I want to thank you all for coming today. My name is Cynthia Helpingstein, and I'm the Program Director for the Coulter Translational Partnership Program here at the University of Missouri. We're here today to celebrate the 4th annual selection of the Coulter Program's Translational Research Awards. The awards are designed to give promising medical discoveries a final boost in research funding to help them succeed in the step of making that transition from the laboratory to commercialization. At the University of Missouri, our faculty members conduct groundbreaking research into health conditions such as cancer and heart disease. These are conditions that affect millions of people. Many of these discoveries hold great potential to improve the lives of people throughout the world. However, these research projects often require a bit of additional investment to demonstrate their technical feasibility and their potential to help patients and society. Today's grant announcements mark the 4th year of Coulter program grants, and they represent efforts of many people. You'll notice in the printed program, we're recognizing all the research teams for the past 4 years. We also want to particularly recognize Dr. Patricia Oker, Senior Associate Provost at the University of Missouri, Dr. Jerry Parker, Associate Dean for Research at the University of Missouri School of Medicine and co-principal investigator for the MU Coulter Translational Partnership Program, Mr. John Gillis, student researcher on one of the Coulter-funded projects, Dr. Jin-Lu Tan, principal investigator of the MU Coulter Translational Partnership Program, and the James C. Dowell, professor and chair of the Department of Bioengineering. And we also want to recognize the Coulter Oversight Committee that works closely with us. Next, I'd like to turn the microphone over to our Senior Associate Provost, Patricia Oker, who will speak about the research environment here at Mizzou.
Thank you, Cynthia. Thank you for inviting me here today, and thank you for your leadership with the Coulter Translational Partnership Program, of which we are very proud. We have much to celebrate today. We are part of an elite group of 16 universities nationwide and the only university in Missouri to be selected for this partnership with the Wallace H. Coulter Foundation. MU is one of only 6 public institutions nationwide that can claim a medical school, a veterinary medicine college, and a law school on the same campus. And our faculty members also have immediate access to the largest nuclear reactor on any university campus in the United States. Because of these valuable resources and the strength and breadth of our faculty researchers, MU is well positioned for translational research, taking research discoveries in the laboratory and helping to transform them into health products and services that improve the lives of patients. And we have significant evidence of our continuing success. In just a few weeks, we'll welcome Dr. Elizabeth Libera as our new Dean of our College of Engineering. A biomedical engineer, Dr. Libera comes to us from the University of North Carolina, Chapel Hill, and North Carolina State University, and she shares the same passion for translational research as do the researchers we are recognizing today. Other signs of MU's success include Mizzou advantages One Health, One Medicine, which fosters interdisciplinary collaboration among faculty, staff, students, and external partners to solve real-world problems, such as designing more efficient electronic health records to better meet the needs of physicians and to deliver the best care to patients, and developing new treatments for prostate cancer using nanotechnology. As you can see, the Coulter program is a testament to MU's culture of interdisciplinary collaboration. The Coulter project selected in 2015 involve a total of 11 co-investigators from the MU School of Medicine and College of Engineering. And to tell us more about the importance of these collaborations and the projects, it's my pleasure to introduce you to Dr. Jerry Parker, Associate Dean for Research at the MU School of Medicine and co-principal investigator for the MU Coulter Translational Partnership Program. Jerry?
Thank you very much, Dr. Oker. At MU, we are known for working across disciplines to solve complex problems and to make important discoveries. By leveraging the knowledge and expertise of our faculty from colleges and schools such as engineering and medicine, MU is able to meet its mission to all Missourians to provide the benefits of a world-class research university. Our Coulter program is an exceptional example of the strength of our interdisciplinary culture at the University of Missouri. By combining the expertise of faculty from engineering and medicine, we're able to propel discoveries towards the next step in the innovation process across what is sometimes called the Valley of Death, to the point where they are sufficiently developed that industry is willing to invest in them and thereby to create commercial products that can improve health and save lives. Each Coulter team has 2 collaborators. One is an engineer and one is a clinician. And to be selected, each Coulter project was rigorously reviewed by an oversight committee that was comprised of entrepreneurs, scientists, industry representatives, venture capitalists, and other experts. The committee chose research projects that they viewed as both having a compelling clinical need and also as having the potential to be competitive within the commercialization landscape. All of these projects are aimed at finding solutions that can benefit patients in a very real and practical way. To tell you more about the Coulter program and the projects we are recognizing today, I would like to introduce John Gillis. John is a student researcher studying computer engineering in the College of Engineering. I might add that John was born and raised here in Columbia. He is the son of Professor Kevin Gillis, an MU faculty member in bioengineering and jointly in medical pharmacology and physiology. And John is working on a Coulter project entitled Panacea's Cloud, which is a hands-free device that allows first responders in mass casualty disasters such as tornadoes, hurricanes, earthquakes, many other situations, to effectively communicate in areas that have compromised phone and internet service. It's a very serious national and international problem. Indeed, John has made tremendous contributions to this innovation, and he is an example, an excellent example of how the Coulter program is having an impact on the entrepreneurial culture at MU, including our educational programs and our opportunities for students. So I'd like to introduce John.
Thank you very much. I want to echo what Dr. Parker said. The University of Missouri is the ideal venue for the Coulter program. My name is John Gillis, and I am a sophomore here at MU studying computer engineering. I've always been interested in software and hardware development and really enjoyed developing innovative products that change people's lives, which is why I was drawn to the Coulter program, and the project we're being recognized for today is Panacea's Cloud. Panacea's Cloud started in June 2014 with an idea from a Mizzou computer science professor, Dr. Prasad Kalyam, a medical professor, Dr. Salman Ahmad, and myself, who was at the time a Mizzou student less than a month out of high school. I started as the sole undergraduate researcher on the project, with the goal to create a system that allowed medical professionals to communicate during a disaster with no assumed infrastructure present. After working full-time over that summer, I had created a working prototype of the system. It was thrilling to test it on the quad for the first time with the whole team and to really see that it worked and the progress that it made from an idea to an actual working prototype. We went on to then test it in a lake simulation with many patients spread across the lake. And then that was such a success with the paramedics that it ended up sparking it from a small one-off project to now a long-term research endeavor. The past year, the team and I have expanded the project's reach. We have published and presented our work through the 2015 IEEE Mobile Cloud Conference. The project has generated a patent and looked towards commercialization with the beginning of the Coulter bootcamp process. The boot camp really guided the team in defining how the project could expand into a project. I personally learned a lot about the steps and what it takes to be able to take cutting-edge research to the marketplace. The program led to refinements in our business plan and strategy through all the incredibly diverse feedback from other participants and the advisors that were there. The work I've done with Panacea's Cloud has allowed me to further my education and make an impact on the world. And because of Coulter, we were able to continue to increase that impact. Due to this new funding, the team has already expanded to include 3 undergraduate and 2 graduate researchers working on the project. The team is now larger and already developing the project and testing its limits with new hardware, new scenarios, and growing the project as a whole. This would not have been possible without the Coulter Foundation. Coulter has provided me the invaluable education of being able to work through the commercialization process of research. An experience like this is not available anywhere else. I would like to thank everyone who has been involved with Coulter and the Coulter Boot Camp for all the great feedback and their support for Panacea's Cloud. I would now like to invite Dr. Jinglu Tan, Chair of the Department of Bioengineering, to introduce this year's Coulter research teams. Thank you for all your time.
Thank you, John. I think John is a very good example to show another dimension we have not featured in the past, that is the impact of the program on our students. So we want to become an entrepreneurial campus that should involve our faculty and our students. So I always have the fun part of the program, so it's my pleasure to announce this year's winners, the project teams. In this round, we selected 5 projects. As was already mentioned, there are 11 faculty members, principal investigators involved. The first project is going to be led by Dr. Roger Fields, Associate Professor of Mechanical and Aerospace Engineering, and Dr. John Padalis, and Associate Professor of Child Health, and Ramad Amjad, Assistant Professor for Child Health. And the 2 of them are sitting here. Why don't you stand up and be recognized? And their project is about developing an automated oxygen supply system to pre-birth, early birth incubators. The current system is manually controlled, increase fatigue in the nursing staff, and this new system is going to improve the accuracy and reliability of the incubator. And that's a very important engineering contribution in my mind. The second team is going to be led by Dr. Randy Curry, Professor of Electrical and Computer Engineering, and Dr. Nick Goda from the Department of Dermatology. And their project is about developing a new laser application device that will prevent laser leakage and in dermatology treatment procedures. So that's going to improve the safety, the laser application to the physician that's using it, and also improve the accuracy of the treatment. Thank you. The third team members are, well, we already mentioned, so Dr. Prasad Kaliam, Assistant Professor in the Department of Computer Science, and Dr. Kalmi Ahmad, Assistant Professor of the Department of Surgery, and also John Gillis is a part of the project, and that's the Panacea Cloud. I would like to emphasize that system is designed to provide visual and audio information when power is down. There's no internet. So that's a very, very important, and it's going to be very helpful in disastrous situation. Thank you. The fourth team members are Dr. Mahmoud Al-Mazari, an Associate Professor of Electrical and Computer Engineering, and Dr. Shuping Zhang from the Department of Veterinary Pathology. And their project is to develop a new sensing technology that will sense salmonella. And they're using a microchannel type of technology, and that's going to dramatically improve our ability to detect foodborne pathogens. Thank you so much. The fifth team is going to be led by Dr. Raghu Canning. I saw Dr. Canning somewhere. Dr. Canning is an associate professor in the Department of Bioengineering and Radiology, and Dr. Dean Hainsworth from the Department of Ophthalmology. And they are developing a new sensing technique that will detect diabetic retinopathy. And this is going to be very simple, easy to use, so it can be easily provided and administered by a primary care physician or by the patient themselves, so that we can detect potential problems early. Thank you so much. As Dr. Parker mentioned, and the program requires that each project team consists of at least one physician, clinician, and one engineer. These are truly interdisciplinary projects. And by funding these projects, we hope they will advance these projects to a point where it will attract external VC funding or licensing. And that is a very important step to promote entrepreneurship and innovation on this campus. So we are very, very, very proud of these researchers, and they're working hard on their projects. So for the one last time, I'll ask Cynthia to come to the podium.
Well, I want to thank you all for coming today and helping us celebrate this event. And thank you, Dr. Tan, for the introductions to the teams. And I just want to add my personal congratulations to the teams. I know how hard they work on a daily basis, and how hard it is to do the kind of things they're doing, not just the research as well as the thinking differently about how to get this into the hands of patients so it can really improve patients' lives. So I just want to encourage everyone to take a few minutes afterwards to meet the teams. You know, they're happy to talk to you about their research, and I think you'll enjoy learning more about that. And I'd also like to encourage all of you that can to stop by the demonstration for Panacea's Cloud, and that'll be, I think, some of the projects do better with show and tell than others, but this is one I think that will be an interesting experience for us. So again, thank you for coming, and please enjoy the refreshments, and look forward to seeing you next year. Thank you.